Well, good morning. We'll get started here maybe a click early. My name is Ken Cook. I happen to be a pediatric blood stem cell doc. I currently am at the Johns Hopkins Children's Center. Just moved there about a year ago, and I direct the program there. Today I'm going to be the moderator for this session, and I've already told Dr. Lowry that after the session I'm going to sit and talk to her about sleep as well, but this I think is going to be really a terrific hour. We're looking forward to hearing from Dr. Lowry, but also to make sure that this is a very interactive session. Technically we're going to wait until the end to ask questions, but if Dr. Lowry is okay with it, I mean, if you really have something burning, I think you could easily raise your hand. So it's really meant to be interactive. This will be audio taped, so at the end when we do take questions, I will be walking around with a mic so that we can make sure we can capture your questions. So please join me in welcoming Dr. Amy Lowry. She's a clinical psychologist at the University of Pennsylvania Medical Center, and she runs a sleep clinic there for patients and caregivers. She has extensive clinical and research experience in symptom management for cancer patients and survivors, particularly sleep, pain, depression, and anxiety, and has received numerous awards for her work. The presentation will generally go about 30 or 40 minutes or so. We again want to leave enough time for discussion, and I'm going to say, Amy, I'm a little jealous. My room had about 10 patients, and this is like the rock star room, and so this should really be great. I think it's a hot topic, and I will turn the discussion over to you.
Thank you. Can everybody hear me okay? I have no sense of how loud the microphones are. Thank you very much for coming and for having me. I feel like I'm kind of hiding here behind the podium and the table, so if you can't see me and you want to move to the other side of the room, that'd be great. Otherwise, I apologize for sort of being in the corner here. Anyways, I'm really excited to talk to you guys about sleep. I could talk about sleep all day, but if I start to see eyes closed, I'm going to assume that it's a compliment and that my talk is working. It's fine if you want to ask questions as I go. If it's something I am going to cover, I'll just say I'm going to get to that. But in my experience, sleep is great when it's an interactive topic, so ask questions, and I'm happy to answer any questions that I can. So just to give you a little bit of background, I started out at Sloan Kettering in New York City doing my fellowship. I was doing symptom management work, mostly research, but treating people as well in the counseling center. And I noticed that sleep was just a very, very common problem. And I thought, what are people doing about this? And it turned out not much. And so I thought, well, that's not right. So I started looking into treatments, and it turns out that there's some very, very effective treatments that are not medication to help people sleep better. So I said, well, let's see how this works. And so I started seeing people for different problems, insomnia, circadian rhythm problems, which I'll talk to you about what those mean. And it turns out these treatments are very, very effective, and it became a very popular service. And a clinic started, and then I ended up going to Pittsburgh because of this work, and they had me start a sleep clinic there, and it's also been very popular. So I'm going to share some of the work that I do there, and my biggest thing is I like giving people education on sleep because most people don't know a lot about sleep, and also give you lots of tips of things that you can try immediately to help get better sleep. So by a show of hands, how many people had trouble sleeping, if you don't mind disclosing? Okay. All right. Well, that seems about right. And you're in good company because it's a very, very common problem. And like Ken said, every time I give a talk, even if it's to docs, nurses, it doesn't matter. My talk might be about how to help your patients. It always turns into, well, I'm having this trouble sleeping too. So it's a pretty universal phenomenon. So let's get started. So some of the things that I'm going to cover are mechanisms of sleep, talking about sleep specifically in transplant survivors, some common sleep problems that people have. I'm going to talk about causes and consequences, and ways to improve your sleep, and importantly, when to seek help, because that's sometimes it really does need to be help. Okay, so very briefly, and this is I'm going to go through this part quickly. I don't want it to be boring, but it is important, so try to stay with me. So we have several stages of normal sleep. Is there something wrong? Oh, so you can see me? That's fine. Can it be moved?
Yeah, can we move it? It's on wheels.
Hi. It's good to see you guys. Great, that's so much better. Hi. Okay. So when you're sleeping, people like to think that, we just sort of turn off when we sleep, but that's actually not true. We're very active when we sleep. Our brain is going through several stages of sleep. Stage 1 is twilight sleep. This is when you kind of fall asleep on the couch. You are kind of sleeping. If your partner walks in, it totally looks like you're sleeping, but if they turn off the TV, you wake up and say, hey, I was watching that. It's actually sleep. You are sleeping, but you're also very connected to your environment. You're still taking in things that you hear. You're very easy to wake up. Sometimes you might not even think that you were sleeping. Stage 2 is light sleep. So you're less connected to the environment, but you're not in a very deep sleep. I'm not going to go into what characterizes these things in terms of what wavelength your brain's in and all that, but it's sleep, but it's not real deep sleep. Stage 3 and 4 is the deep sleep. This is the good stuff. This is the stuff you don't want to miss out on, because this is when your body is going through a lot of important changes. Damaged DNA is being repaired, bone is being repaired, tissue is being repaired. All sorts of things in your body are being cleaned out. It's kind of like the janitor staff at night that comes through the offices, vacuums, empties, trashes. It's very important for your body to get enough deep sleep. And then we have rapid eye movement. This is where we dream. And most people have seen somebody, maybe even your dog, in REM because their paws start going and their eyes start moving back and forth. And this is where we dream. REM is very important to our emotional and mental well-being. So deep sleep is important for us physically because it's helping our body. REM is important for us emotionally and mentally because this is where it's taking all the information that you took in during the day, and it's sorting out what's important to keep and what's worth getting rid of. And so it's consolidating memories, it's going through different emotional things that you had, and you are totally unaware that all of this is happening. But it's very important. When we don't get enough REM sleep, we wake up and we feel kind of groggy, kind of foggy, our concentration isn't good, our memory isn't good. Anyone who's had a night of insomnia knows you kind of feel like crap the next day. Mostly it's because we didn't get enough REM sleep. So this is a graph that shows the cycles that we go through throughout the night. So you can see when you fall asleep, you go to stage 1, 2, and then down to 3 and 4. And you stay there for about a total of 45 minutes or so, and then you go back up to 2, 1, and then you have REM. Does this part make sense? You guys following this graph okay? You cycle back down again to deep sleep, but this is only for a short period of time, and then you cycle back up to REM. The next time you cycle through, you only go to stage 2. And you can see as the night goes on, REM gets longer and longer. So your last hour of sleep is pretty much all REM sleep. But that's if you're getting a good 7 hours of uninterrupted sleep. Another important thing to notice here is that by hour 3, you've had pretty much all the deep sleep you're going to get for the whole night. So this is important to know because for people who have insomnia or for people who have very interrupted sleep, I like to emphasize that it's very important to make sure that you get at least 3 hours of uninterrupted sleep. Now that's not enough, but you can be rest assured that after 3 hours, you've gotten all the physical benefits that you're going to get from sleep. So you're not doing your body any harm. You might not feel great emotionally or cognitively because as you can see by hour 3, you've had maybe 10 minutes of REM and you need many more hours of it. But the important health benefits that are very necessary in your immune system, fighting disease, those are pretty much taken care of by hour 3. So, any questions on this graph? No? Okay. Okay, I'm almost done with the boring stuff, and then we'll get to the fun stuff, but there is a reason I'm telling you these things. There's 2 processes that drive our sleep, because people wonder, well, why do we sleep? What's making us sleep? 2 things. One is called the sleep drive, and one is called your biological clock. And here's both of them. The sleep drive is that S. It's like that straight up line and then the straight down line. It basically means the longer you stay awake, the sleepier you're going to be. And the only way to reduce that sleep drive is to sleep. Very straightforward, very basic. The longer you're awake, there's actually a chemical that builds up in your body that's making you sleepy. And the only way for that chemical to decrease is by sleeping. It's a very straightforward drive, but there's a couple important things to remember in this drive. One is that what happens if you take a nap? Might wake up tired, but if you take a nap in the afternoon, your sleep drive is going to go down. And then by evening, you're ready to go to bed, but your sleep drive might not be as intense as it would be if you push through. I'm not saying naps aren't important. We're going to talk about naps, but naps have to be careful. You can't just sort of fall asleep when you want. People who fall asleep as soon as they feel sleepy and wake up when they feel like they have had enough sleep end up getting styles more like your pet, like the cat and the dog in the house. They kind of sleep and then they wake up and then they sleep and they wake up. And that might be fine, but it's kind of hard to have a day when you're just sleeping and waking up every few hours. So important to remember, the longer you stay awake, the more sleepy you're going to be. Well, this also means that if you don't get a good night's sleep, you're already starting out at a deficit. So you're already starting out with your sleep drive higher than it should be, and then it's a lot harder to get through the day. Does this part make sense? Okay. Now, yes? Yeah, I can't get rid of those numbers. You can just ignore them at the bottom. Yeah, I don't really know what they mean either. It's not my graph. Yeah, it is. I think it's over the whole 20. You're right. Yeah. There's another thing going on, and that's that curvy line at the bottom, and that's your circadian rhythm. Has anyone heard of your circadian rhythm before? Is that a term you've heard of? Yeah, circadian rhythm, biological clock. We all have clock genes in our body that regulate different biological processes, our heart rate, our body temperature, our hunger drive, all sorts of things are happening on a clock system. Now, the reason this is important is because how many people get sleepy around 3 o'clock? Pretty common. Yeah, like that afternoon slump, maybe 2 o'clock, maybe 4 o'clock. It's not all the same for everybody, but something happens a little after lunch where everyone just sort of gets tired and you're like, oh, how many more hours until work is done and I get to go home? But then how do you feel around 7 p.m.? Do you feel more tired? No, mostly you're actually more awake. There's something that happens. We have this little afternoon slump, but then we kind of perk up again, and around 7 or 8 we actually feel like, okay, I'm okay, I can do this. Some people even get more energy and can kind of go longer into the night feeling more awake. This is because of our circadian rhythm. So our circadian rhythm is, like I said, they're clock genes. It's tied to the environment, and it is reset with the first exposure to light that you have, which in generally is the sunrise. And that resets your clock on the 24-hour cycle. So it's restarting your day when the sun rises and you have your first light exposure. This is why it's hard when you travel time zones. Has anyone traveled to a different time zone? It's really weird. It takes a couple days to kind of get on a system. You're eating at times that you're not necessarily hungry. You're sleeping at times, kind of just feel really off. So the circadian rhythm is important because that light is what keeps the circadian rhythm on track. Light is going to activate us, and darkness is going to make us sleepy. And if our environment is giving light and dark at different times, our circadian rhythm is really going to be messed up. This is important in this industrial age that we live in, where we can make artificial lights whenever we want, and that's going to be an important piece that I will talk about. Any question on this piece so far? It's fine if you don't completely understand it, but as long as you have a basic idea of what I'm talking about. Yes?
To me, the numbers at the bottom mean that good night's sleep, and going back to an earlier slide, so 7 a.m., I wake up at 7 a.m., bingo, I go to bed at 11
Right.
a.m., so I'm in theory getting 8 hours of sleep.
Right.
Is that what you consider to be a good night's sleep for someone in their 60s and 70s?
That's a really good question. I get that a lot. There's sort of this idea that 8 hours is optimal. There's no easy answer because everybody is different. And most people aren't getting 8 hours. Now, if you're not getting 8 hours because you don't feel like you need 8 hours, then that's fine. Some people only need 6 or 7. If you're not getting 8 hours because by the time you get home and do everything you need to do and get into bed, there's only 5 hours until the alarm goes up and you have to do it all over again, that's not a good thing. So I see lots of doctors who say, oh, I only need 5 hours of sleep. And I say, I don't believe you. I believe you only can get 5 hours of sleep because that's how busy you are, but I don't know that you actually only need 5 hours of sleep. So it's hard to say that you need 8 hours, and especially as we age, our sleep changes, and I can talk a little bit about that. But if you don't feel like you need 8 hours, don't try to force yourself, because what will happen is you'll actually give yourself insomnia if you're trying to sleep. If you try too hard, you're going to give yourself insomnia. Okay? And I'll talk about that. Okay. Any questions so far on the stuff we talked about? That's just the basic sleep education 101 I just gave you. Now we'll get into the good stuff. Okay. So among people who have had a bone marrow transplant, well, in general, among people with cancer, sleep is one of the most common problems that have been reported. And among people who have had transplants, about 30 to 50% of people report having sleep problems, and this is post-transplant, not immediately post-transplant, like at least 1 year post-transplant. It's higher during active cancer treatment. So I'm actually doing a study right now where I'm looking at people who are going into the hospital for their treatment. And as you may know, if you've been through this yourself, you're in the hospital for quite a while. So it's not like a couple days. It's usually more like a couple weeks, sometimes even a couple months. And a lot of people develop sleep problems while they're in the hospital for lots of reasons. But it's one of the most difficult times to sleep, and it can last even after people have been discharged and go back home. And in general, sleep problems are 2 to 3 times higher than the general population, and that's saying a lot because the general population has trouble sleeping, as we know from this guy. Okay, among transplant survivors, 26.2, this is one study, found that 26.2% of survivors met criteria for a diagnosable sleep disorder. Now, this is different than just saying, do you have trouble sleeping, yes or no? Or give them a questionnaire and say, tell me how severe your problem sleeping is. This is actually meeting criteria for a diagnosis. There's a higher risk of this problem in females and those treated with this specific type of agent. 51% of bone marrow transplant survivors reported sleep problems in another study that was done, and this did not change over 18 months. And this is a pretty big deal because to have trouble sleeping that's short-term is one thing, but there's a lot of serious problems connected with chronic sleep problems, and 18 months is a pretty long time to be having sleep problems. The study found that it was higher in females, higher in people who had older age, and those treated with TBI during their pre-bone marrow transplant conditioning. Okay, so while I was at Sloan Kettering, Christine Iovino, who's actually presenting here, she's doing a talk on some of the long-term effects. She did a study at Sloan Kettering looking at how frequently patients were bothered by sleep in the past 2 weeks. And you can see that 8 and 10%, wait a second, why is this not matching up? Oh, more than half the days and almost every day are the 8 and 10%, and that's a big deal. So more than half said that they weren't bothered at all, and that's fabulous. I want to talk to them more and find out what they were doing that didn't have any sleep problems. And 24% said several days. But the people who said more than half of the days or almost every day, those are the people that I'm most interested in, because it's pretty common to have an occasional night of bad sleep. But if it's happening more than half the days, that's a real problem. And we found that in this study it was higher in females and higher in those using sleep medications. Now, doesn't that seem opposite? People who are taking sleep medications, you'd think they sleep better. But actually, we find that people who take sleep medications are not necessarily sleeping better. They're having problems sleeping even more than people who aren't taking sleep medications. We'll talk about that in a minute. Okay. Common sleep problems. Has anyone heard of sleep apnea? No. Yeah. Sleep apnea is basically pauses in breathing. It's a very serious problem because it actually results in lack of oxygen during sleep. You basically stop breathing and you're depriving yourself of oxygen, and then there's this sort of gasping for air that happens as we catch our breath. It's characterized by loud snoring. So what's interesting is that people don't always know that they snore, but their bed partner does. And they'll say, no, I don't snore. And we say, okay, bring in your husband. Okay, bring in your wife. Do they snore? Oh, they snore terribly. But not everyone that snores has sleep apnea, and that's the important piece. It's a certain type of snoring. It's an uneven snoring, There's a pause, and then there's this sort of like catching of your breath, almost like gasping for air. And one of the hallmark symptoms of sleep apnea is feeling sleepy the next day. I can always spot somebody with sleep apnea because when I go out into the waiting room, they're sleeping in the chair in the waiting room. These people could fall asleep anywhere. There's several different treatments for sleep apnea, but the most common one is a CPAP machine, which you've probably heard about. People generally don't like them, so there's a really high rate of non-compliance. But it's very important because basically you're being deprived of oxygen, and there's lots and lots of research showing how dangerous that is, and CPAP machine will correct that. So it is a getting used to, but they're getting better. They're not quite that huge face mask. They're becoming more small just for the nose. They are a pain in the butt, and they're not very sexy, but they are important for your health. All right, briefly, circadian rhythm sleep disorders. So we talked about the circadian rhythm, that 24-hour kind of wave-like cycle where we are awake at different times and feel sleepy at different times. There are some sleep disorders associated with this, and it's basically when what your body wants to do doesn't match your environment. So it's common for people who work the night shift, right? Because the world is sleeping and your body's telling you want to sleep, but you can't because that's when your job starts. And then you're going home when the sun's up, and that's your night, and you're supposed to be sleeping, but now the sun's just activated you, and now you're awake and feel like maybe you should get some things done before you sleep because you feel awake and you can. It's actually a very terrible problem to have. It's something that I'm looking at more and more in people during their hospital stay, because when you're in the hospital, you don't have those strong environmental cues that you do when you're outside. I always go in to see patients, and during the day, their shades are closed, the room is very dark, they're trying to take a nap, and then I'll see people in the evening, and they have all their overhead lights on, and they're sitting there awake trying to interact with people. So this is important for people who maybe don't feel sleepy and awake at the times that they would like. And if this is something you want to talk more about afterwards, we can. I'm going to move quickly because I'm talking too much. Insomnia. So this is when you have trouble falling asleep, trouble staying asleep. You wake up a lot throughout the night. You wake up early in the morning. You wake up feeling tired and sleepy. This is the most common sleep disorder. I'm going to talk very quickly about the causes. There's 3 different causes. There's predisposing factors. These are things that you can't help. They just make you more vulnerable to having trouble sleeping. Everybody knows somebody in the family who has trouble sleeping no matter what. The kids didn't come home at curfew. Mom's up. She's worried. Meanwhile, Dad's snoring away. The world could be coming to an end, and it's not going to interrupt his sleep. So females tend to have more vulnerability. Some people have family histories. Also, people with type A or stressed people are more likely to have trouble sleeping. That's not going to give you insomnia. Something has to actually cause it. This just makes you more vulnerable to it. The precipitating factor is what's going to actually cause it. It's usually precipitated by stress. Cancer treatment is stressful. Getting diagnosed with cancer is stressful. Being in a new environment is stressful. Having symptoms, not that all these things are just stress, but being up all night with nausea is going to make you have trouble sleeping. Being in the hospital in a new environment is going to make you have trouble sleeping. And also lots of things having nothing to do with cancer, going through a divorce, even positive stress, planning a vacation or planning a wedding. But something usually causes the insomnia. Now, the idea is that eventually that stress goes away, or you get used to that stress. You acclimate. You have some coping resources that make it not so threatening, and the insomnia goes away. But for some people, it doesn't go away. The stressful event might not be so stressful anymore, or the reason that it was caused might have gone away, but they're still having trouble sleeping. This is why insomnia can last for years for some people. That's because of perpetuating factors. These are the things that are causing it to be long-term. They're generally behaviors, but they're not always behaviors. But they're things that we do that initially were to help us get through the insomnia, but are now causing more problems. So things like spending extra time in bed, taking naps, worrying, stress. And this is where I intervene the most with people, because usually we've adapted some behaviors that were once helpful, and now they're causing problems. And this is just a graph that shows that. Negative consequences of insomnia, well, it affects our mood, it affects us physically. Research has shown we're more likely to have pain sensitivity, fatigue. It affects our memory and attention, impaired work performance. There's safety concerns. FDA just put out a new thing that Lunesta, even given it at its recommended dosage of 2 milligrams, is 11 hours after taking the medication, causing people to be so impaired that they're driving as if they're drunk, and they're having cognitive impairments and memory impairments even 11 hours after taking the medication. So the FDA is very concerned about these medications that most people are taking. Risk of falls is high, and also insomnia affects our health and our immunity. I'm just going to skip that one. Okay, ways to improve your sleep. This is what everyone wants to know. Most people take medication. I mean, it's just a fact. It's just what it is. When I am trying to find out more about what people are doing with their trouble sleeping, it's almost always medication. Why? Well, it's a quick fix, people think. You know, a lot of people say, I just want to take a pill. It's a lot easier than talking about things. And also, a lot of the doctors are completely helpless because they have no idea what to do to help people with their sleep. Their patients are telling them, I'm having trouble sleeping. Well, they're going to give you a medication for it because they exist. So there's a whole bunch of medications that people are taking. But is this okay? Well, no, it's not okay. Because there's lots of problems associated with this. And I'm not saying all medications are bad or there's never a time to take, you know, a sleeping pill. But if you think back to the graph about the short-term sleep problems and the long-term sleep problems, if there's something going on, you know, you have an MRI coming up and, you know that it's tomorrow and you're going to be worried about it and so you want to just sleep through the night. Okay, that makes sense. Why does it make sense? Because in 3 days when you got the results back and things are fine, you're not going to have this problem anymore. You're going to probably be sleeping fine. So it's a short-term solution to the problem. But if you've been having insomnia for 18 months and you're going to get a pill, what are you just going to take it for the rest of your life? What's the stopping point? And for a lot of people, they take it, it works for a little while, and then they start having sleep problems again. So what do? Take 2? So there's a real problem with sleep medications. Also, on top of that, there's the next day drowsiness, dizziness, there's like a foggy thinking, there's a risk of tolerance and dependence. Also, get this. Remember the first thing I was talking about with our sleep stages and stage 1 and stage 2? Do you know what sleep medications do? Same thing as if you were to take alcohol to fall asleep. It cuts out stage 3 and 4, and it cuts out REM. It basically puts you in stage 2 for the whole night. So you're not really getting good sleep, which is why people say, well, yeah, I slept 8 hours, but I feel like I could sleep some more. It's not making you feel really rested. So you look like you're sleeping, and you are sleeping, but you're not getting good sleep. Also, we really don't know what's happening. There hasn't been that much research done on a lot of these medications. If you read the bottle, it says it should only be taken for 2 weeks. The FDA doesn't really recommend taking it any longer than that. Yet I see people all the time taking it for more than a year. So we're not really using it the way that we should be. Am I out of time?
No.
Okay, good. So let's talk about the take-home messages here. Let's promote good sleep behaviors. When I work with people, and I need to highlight this because everyone always thinks there's like a nice little handout I can give you to teach you how to sleep. And to some extent there is, but the work that I do with people, it's very individualized. People are very different, as you know. The things that are giving you trouble sleeping are not going to be the same for everybody, so there isn't this nice little cookie cutter treatment that I can just tell you about you can go home and implement. I'm going to do that the best I can, but don't think that these tricks are going to make your sleep completely perfect because it is very individualized and it would be a lot of one-on-one finding out what's getting in the way of your sleep and what we can do to help you sleep better. But that said, if I was to sort of hand out a universal tips for helping you sleep, these are the things I would say. Stick to a sleep schedule. Why do you think this is important? What have we talked about earlier that might make this routine important? Right, the circadian rhythm. If we're going to bed and we're getting up at the same time every night, it's kind of like, you know, when you're raising a kid and you want to get them on a schedule. If you put them to bed at 8 o'clock every single night, they're going to know at 7 o'clock, okay, I'm going to be going to bed at 8 o'clock. They might fight you, but their body will start getting used and winding down and getting sleepy. If you're on a schedule where one night you're falling asleep at 8 o'clock, next night you're falling asleep at 1 o'clock, it's going to be very, very difficult to get your body used to any type of schedule. So as much as possible, stick to a routine. The most important thing is actually not what time you go to bed, but what time you get up. Because if you remember, that's the reset for the whole 24 hours, is getting that light exposure in the morning. So regardless of what time you go to sleep, getting up at the same time is important every day. And your body will just naturally be sleepy when it's ready to. The second one's probably one of the most important things I can say. Have the right amount of sunlight exposure. Now, I'm not saying go sit in the sun and get skin cancer. What I'm saying is open up your shades. It's not about being in the sun. It's about getting that daylight coming in your windows. Even on a very gray day, you're going to get more daylight exposure than any light bulb you can have in the house. So having light in the morning is going to be very, very important. If you can get outside, if it's a nice day, do it. Use your bedroom only for sleeping and intimacy. People do all sorts of things in their bed. They read, they watch TV, they eat, they talk on the phone, they play with their iPad. What you're doing is you're decreasing your association of the bed with a place to sleep. So limit what you do in bed. If you like to read, read on a chair before you go to bed, or read on the couch before you go to bed. Avoid caffeine and nicotine. So many people are guilty of caffeine. I used to be hugely guilty of this one. But do you know how long caffeine stays in your body? There's something called a half-life. I don't know if you've heard of what that is, but it's basically when you take some substance, a medication, or in this case caffeine, it's the amount of time it takes for it to be at half of its concentration, which means it's still in your body at half of the max concentration. Caffeine has an 8-hour half-life. So if you have caffeine at 10 o'clock in the morning, or what time is it now, noon? And I see some coffee out there. At 8 o'clock tonight, you're still going to have half of that concentration of caffeine in your body. Good luck trying to fall asleep. You might not notice it. You might not feel awake and alert, but your body is actually has these things going on. So you're kind of being your own worst enemy if you think about it. So be careful with the caffeine and know that it's not just coffee. Soda, Mountain Dew, chocolate, all sorts of things have caffeine in it. Don't take naps after 3 p.m. Why is this important? Because of that sleep drive. Naps in general are dangerous because the more we sleep during the day, the less likely we're going to be sleepy at night. But, okay, I'm out of time. But if you have to nap, which you can do if you are careful with it, just try to keep it before 3. I actually tell people try to keep it before 1, and try to keep it to about 30 minutes. That'll help you feel like a little bit more rested without really impairing, your sleep drive for night. Exercise is great, but not too late in the day because it will activate you. Avoid alcoholic drinks because just like the medications I was telling you about, this will impact your sleep architecture, which means you won't be getting the deep sleep that you need. Avoid large meals and beverages late at night. Avoid medicines that delay or disrupt your sleep if possible. Again, you want to talk to your doctor about this, but often I'll see people who are taking a medication in the evening that actually has some stimulating properties, and they won't realize that they could have taken it in the morning if they talked to their doctor. It's totally fine to switch it. But again, you need to talk to your team about that. Relax before bed. Don't be working up until the last second trying to watch TV and play on the internet. Try to spend that last hour or two before bed really unwinding. Only dim lighting in the evening. Why is this important? Because just like you need light in the morning, light in the evening is going to activate you. So if you have too much bright light, it's going to basically keep your brain alert as if it was the sun. Sometimes taking a hot bath before bed is good. Have a good sleeping environment. It should be a cave. Dark, quiet, and cold. Cool. Stay off the computer. The computer is light. And what are the things we do the hour before bed? We turn on the TV, we play with our iPads, we go on the computer. We're basically shining light right in our face, and then we're wondering why we have trouble falling asleep. No clock watching. This is a big one. The more you stare at that clock and count down, if I fall asleep right now, I'll have this many hours until I can sleep and get up. That's just bad. Don't do that. Turn it around. Put something over it. Don't lay in bed awake. Again, if you're laying in bed awake, you're associating the bed as a place to lay awake and worry. If you're not sleeping after 15 or 20 minutes, get up, go into another room, read a book. Don't turn on bright lights. Play crossword puzzles. Do whatever, but go back to bed when you feel sleepy. And the biggest thing is just an occasional night of bad sleep is normal. So once I'm working with people and their sleep is getting better, they'll have a night where it just didn't go well and they get very upset. And I say, it's okay. If it's a pattern, that's one thing. But if you have one night of bad sleep, it's just going to be a really good night the next night because you're going to be that much sleepier. And just know that if you're really having trouble sleeping and none of these tricks are working, that there are people out there that can help you. I'm going to leave my cards out so you can contact me if that would be helpful. But there are people who specialize in this type of treatment, and so I can help you find somebody in your area who can see you to work on cognitive behavioral therapy, which is actually the most research-supported treatment for sleep problems and recommended as the #1 way to help sleep over and above medications. Okay, so I'm not going to summarize because we're out of time. Here's my contact information, but again, I will leave cards. All right, so we have time for questions, right?
That was outstanding. We do have plenty of time, for questions, and that's one of the reasons why we try to finish up on time. So I will have the microphone here so that any questions that are asked will be captured for the audio. So who has questions? Nobody? Okay. No. Imagine that.
You got some in the corner back there, too.
We'll start right here, perhaps.
I get bad leg cramps at night, sometimes 6 and 7 of them, and not really sure what that's related to.
Mm-hmm.
But when I wake up, okay, I get up and just walk around a little bit and then go back to bed and go back to sleep. Do I start the same cycle, or do I start the cycle all over again?
Mm-hmm. So it's a good question. And so there's two things in there. One is the leg cramps. So one thing that I had to take out, but I usually put in my talk when I have longer talks, is restless leg syndrome. I don't know if you've heard about that.
Mm-hmm.
But it's one of the hallmark symptoms is sort of this like cramping or kind of tingling or twitching in the legs. It's actually a sleep disorder. That's what it is. And it is diagnosed and treated by sleep physicians. If it's a problem and you feel like it's really getting in the way of your sleep, I would say see a sleep physician. They would test you with an overnight sleep study, and then they would treat the restless leg syndromes. Unfortunately, the treatments out there are very limited. Sometimes taking a walk before you go to sleep is helpful for people. So there's that one piece of it. The second piece of it is when you go back to sleep, are you starting over? No, yes and no. So you're not exactly starting over, but there is this really cool thing. Our bodies are amazing. We have this like really great way of just maintaining homeostasis. So we have this thing called REM, rebound REM. If we haven't gotten the REM that we need, our body realizes that and it starts it out earlier when you go back to sleep. So you might have not the exact same thing that we saw on the screen, but your body would intentionally start REM sooner if you hadn't had any yet. So my guess is you're okay as long as you're getting some chunks of sleep. If you're getting 3-hour chunks, then you're probably fine. If you're waking up every hour, that's probably not okay.
Well, I'm going to have a overnight sleep
Good.
study
Good.
next week.
Good.
Amy, go ahead and select the people because I won't be able to see who's behind you.
Oh, okay, well, there was a woman back there that's had her hand up, so.
Great.
Yes, I'm a 5-year survivor.
Just 1 second, dear. Here you go.
My name's Joanne. I'm a 5-year survivor, and I've been dealing with graft versus host. And when you deal with graft versus host, the protocol is usually prednisone. And I have been up as high as 100 milligrams of prednisone. I'm not able to get off of the prednisone as low as 20, and then symptoms act up, and then I wind up having to take more. Prednisone makes you crazy.
Yes.
You cannot sleep on prednisone no matter what.
Yeah.
So, all the docs do is, oh, temazepam. Oh, take another temazepam. I mean, at one point, I was taking 3 temazepams, 30 milligrams, and still not sleeping.
Yeah.
And,
Mm-hmm.
now, I'm on lower prednisone, but I am taking 1 temazepam and a little bit of melatonin. I mean, should I? But of course, I'm dependent, and when I tried to decrease the temazepam, I didn't know it, but I was having these crazy symptoms, and it was drug, it was because I was dependent on the drug.
Sure.
I was no longer getting it.
Absolutely. So steroids are one of the most frustrating parts to getting sleep, and I see this a lot. And I actually was called to see a patient about a month ago who hadn't slept in 5 days, not a minute, in 5 days because of the steroids, and had almost started having psychotic features and was becoming suicidal, which was not him at baseline, but it was just this lack of sleep really makes you crazy. So it's a frustrating thing. I try to tell people, even though it feels not temporary, it is temporary for whatever temporary means, and it's about getting through this period of time and then stabilizing your sleep rather than trying to stabilize your sleep right now. So in this situation, I tell people it's okay to break some of the rules. In this situation, it usually is okay to take a sleep medication because you need something to physiologically counteract what the steroids are doing to you. I also tell people, like I said, don't take naps. Go ahead and sleep whenever you think you can. If you feel like you can sleep in the afternoon, try to get some sleep in the afternoon. It's just about getting through that period of time until you can come off the steroids and then try to stabilize your sleep. But it's a really tricky one. I really don't have a good answer for how to get good sleep while you're on steroids. It's a really tough one. Some people find that melatonin can help. The way melatonin works, I didn't get into this just for the sake of time. So melatonin is a natural hormone that we have in our body. Our brain produces it when it perceives darkness. So it's like the dark hormone. And it takes 4 stages from when it's first released to when it makes you feel sleepy. So whether it's your own brain producing melatonin or a pill that you're taking, when you take melatonin, it's going to take 4 hours before it makes you feel sleepy. And most people don't know that. They think of it as a sleeping pill and they take it and then they try to fall asleep. If you're trying to sleep at, say, 10, you should really be taking it with dinner. And melatonin is relatively safe. I mean, I'm not going to go around trying to promote, any type of medication, and I'm not a medical doctor, but melatonin has had quite a bit of research, and it is a naturally occurring substance that we have too. It seems to be safer than some of the other sleep medications out there. So I usually say, to people, if you're open to trying it and you think, it's something you want, then try it. But keep in mind that it needs to be 4 hours before you want to sleep, and also it's not one of those things that the more you take, the more it works. You really only need 0.5 milligrams of melatonin to do what it needs to do. And someone once told me, when I said this in a room like this, you can't buy 0.5. That doesn't exist. And I said, sure it does. And they said, no, it doesn't. And I thought, I have to go check this. And it doesn't exist. They actually start at 1 milligram. So 1 milligram, but it goes up to like 5 or 10 milligrams, and you absolutely don't need that much. So try the melatonin at dinner time. Try Ativan or other things, other medications that can help, and just, try to be patient and sleep when you can. Also, consider the light, because that is a big factor in what makes us sleepy and awake. And I will give you my card, and we can talk more about different things that you can try one-on-one. But it's a tricky one, I have to say. There's a few situations that are really, really hard and so frustrating for me because I can't give magical answers, and steroids is one of them. So.
I'm Joanne's husband, and I'm dealing with some sleep issues as well. I have an issue where, like a lot of folks, men in particular, when we get a little older, we end up waking up in the evening to use the bathroom.
Yes.
We've worked through all of, a number of the things on the list, making sure that there's darkness in the room and, trying to get to the bathroom safely and get back to bed without the lights on is somewhat of a challenge. But one of the things that I'm struggling with is when I wake up and go back into the bed, I have thoughts. And the thoughts are not necessarily of heavy, stressful things, fortunately. A lot of times it could just be any thought. The act of thinking is really the best way to describe it. Can you give us any pointers at that moment when you're laying in that bed and your mind's just thinking, can you, keeping you awake, can you give us any pointers to kind of help us through that?
Yes. So that's a very common one. And the good news and the bad news is that that's completely habit forming. So you didn't just start out doing that, all your life. It's something that maybe happened a couple times, maybe it was during a period of stress, and it's become a habit. And, people will say, well, I don't necessarily think about anything upsetting. I, was redrafting my fantasy football team, and that's what kept me awake, and not stressed about it. It's just, I was thinking of all the names that I could potentially name my children. I mean, it's your mind just starts ruminating. It's because it doesn't have any grasp in reality during the day. We can get distracted by things. We can sort of thought stop a little bit better. So this is what I would say. I would say that if there is something that's on your mind, if there is anything that has any type of emotional tone to it, so maybe these things don't, but sometimes I'm guessing it is that, something that was stressing you out during the day is coming up also. Try to find a time during the day to think about these things on purpose. People don't usually like doing this because we want to avoid things that are bothering us, but we call it worry time. If you can try to do 20 or 30 minutes of worry time in a setting where you feel less threatened, like in the middle of the afternoon, and afterwards you're going to do something that, will help break that up for you, like go for a walk or go watch a movie or go do whatever. But at night, if you start to find your mind wandering, get out of bed. And I know that's not what you want to do because you just went to the bathroom and now you want to go back to sleep. But you need to break that cycle of laying down and thinking. And so go into another room and, sit for 5 or 10 minutes, flip through a magazine, do something just to kind of get your mind off it, and then try going to bed. Or you can try listening to something that's relaxing and try to focus your mind on the relaxing music. But laying in bed with your mind just sort of like going like a ticker tape, that's something that's habit forming. And so if you have gotten into it for a couple nights in a row, it's going to start happening automatically. So.
Amy, if I could add to
Sure.
the issue regarding steroids. So you had mentioned earlier the timing of certain medicinal agents in sleep. So dear, what time do you take your steroids? Okay, I thought I had the silver bullet there, right? But that is steroids. Taking steroids before bed really exacerbates that issue. As a blood stem cell transplant doc, I always want to hear that from my patients, and then you can alter them. Sure, some medicines have to be every 12 hours or twice a day, morning and night. Steroids, not so much, but that was a good first step to actually take those medicines in the morning. Other questions?
Thank you. So our daughter is 21 now. She had a cord blood transplant at 15, and she was kind of in adult hospitals for 3 years almost, maybe more. And I think her life was pretty much back to normal the last year and a half, 2 years. Her issue is the complete opposite. She can sleep forever. I mean, she can sleep literally 16 hours, 17 hours, whatever, and she's very sleepy. So that's our issue.
Okay. So I hear that a lot, and the first thing I say is it's important to think about the difference between sleepy and fatigue. It sounds like she's sleepy, but fatigue is one of the biggest problems that people have, and it's easy to confuse or tie up because they're so related. Just that sort of feeling of tiredness. Tired is like that sort of vague term. What does tired mean? Is it that you just have no energy and you feel exhausted, or is it that you feel sleepy and you actually want to fall asleep? So I try to help people differentiate the difference between fatigue and sleepiness because the interventions are different between the two. If when she sits down or lays down, she immediately falls asleep, then that's sleepiness. There are a couple sleep disorders that will cause those things. One is narcolepsy, and another one is called hypersomnia. I would actually recommend that she see a sleep physician and have an overnight sleep study because she might have something physiologically happening that is causing one of those sleep disorders or something else. But they're very serious because obviously we don't need to be sleeping 16 hours a day, and so if she is, that's a problem. A couple of the things can happen, and again, I don't want to, say things without knowing your daughter, but just things that come to mind are sometimes depression can also cause sort of hypersomnia, which is, that not necessarily sleeping, but sort of that desire to just kind of crawl in the bed and pull the covers over your head. So there's a lot of things that can happen that have symptoms that mimic a sleep disorder. It would probably be best to talk to her one-on-one and find out exactly what's going on. I would say my first recommendation would be for her to see a sleep person, get a night study, see what's going on, and then talk to somebody to see if they can help investigate. But I'm happy if you want to take my card to talk to you more one-on-one about some of that.
Other questions?
Yeah. I'm just, I'm curious, and speaking with this lady, I'm also on steroids, which I do take in the morning, but I'm also asthmatic, so I'm on Advair twice a day. And I'm wondering, should I move that Advair in the evening? I usually take it right before bed. Maybe I should be moving it up in the evening.
That might not be a bad idea.
I never even thought of that till right now.
They're supposed to be kind of focused, delivered steroids, but you can have some systemic absorption. So that might actually help. I don't think it would hurt. It may be beneficial if you were trying.
Yeah, okay.
Other questions?
I've got a combination of all of the above. I've had sleep apnea for 20 years. I'm now on my 4th CPAP machine. I'm a 9-year survivor. Things went fairly well until the last few years. And I've also got prostate issues where I'm getting up at night. the biggest thing that I'm running right now, when I got to the point of having insomnia, and so they have now put me on medication. So I do get into, as you say, some sort of a sleep, but apparently it's not that deep, deep sleep. And when I do dream, I seem to wake up and need to go to the bathroom. It's a combination of everything. I mean, CPAP, I think we've got it at the right pressure now. So once I'm on the machine and I'm asleep, that part of it is taken care of, but it's all the combination of the other things. And I'm drowsy during the day. I mean, it's just not working.
Sure. Sleep apnea and insomnia are such a difficult combination, and I do see that sometimes. So obviously treating the sleep apnea is most important because there's just a lot of risk associated with untreated sleep apnea, so I'm really glad that you get the CPAP machine. The trick is that when you have insomnia, you're basically lying there awake with the machine, and it's not doing its job because you only have sleep apnea when you're sleeping. So some people find the mask is keeping them awake, and that's causing the insomnia, and so then it's sort of like a scales. Which way do you want to tip it? Do you want to get sleep but have apneic events, or do you want to be awake with the CPAP machine on? If you're getting a couple, do you sleep better with the machine on? Is that part of what's causing insomnia, or?
I've never tried it without. I've been compliant for 20 years.
Okay. But you're also having insomnia, so part of the night you're awake, right? Okay. So sometimes I'll tell people, and again, it's hard for me to give you advice one-on-one without having done a full evaluation, so I'm kind of just saying grain of salt out there that I don't want to, be giving you direct advice without having done a full evaluation with you and talk more. But first thoughts would be, sometimes I tell people, if you have a couple hours of sleep where you got the CPAP machine and now you're awake and, it's on but you're not sleeping, take it off, because if you can get a couple hours of sleep with the CPAP machine on, then that's better than not having it at all. But if you're sleeping better without the CPAP machine, then you're getting some sleep too. So it's kind of a balance. Like if you fall asleep initially and you're getting, say, 3 hours of sleep before you wake up, but then you come back to bed and you can't fall asleep, try taking it off and seeing if you can fall asleep. And then you can kind of work back to keeping it on the whole night long. But if you're awake because of insomnia, the CPAP machine is not doing its job anyways because you're breathing because you're awake. So try taking it off for a couple hours, see if you fall asleep, and then reintroduce it. But make sure you're getting at least 3 hours of CPAP sleep too. Does that make sense?
Other questions?
Did you have a question? I saw your hand up earlier. Yeah.
What is HSCT?
That's one of the acronyms that they've...
HSCT?
Yeah.
Yeah, hematopoietic cell
There
stem
you
cell
go. Thank you.
transplant. Yeah, it's like alphabet soup.
It is.
Hematopoietic stem cell transplant, right.
Okay, and I have another comment about the legs. I get cramps at night as well, and I was reading, it's when I...
Don't drink enough water.
Okay.
Because I guess the muscles have to be hydrated. And also, I guess if I'm deficient in magnesium and calcium,
okay.
It's a pattern. So I don't think it's restless leg. I think it's just, like a Charlie horse. I don't know how yours feel, but it can be very intense at times, and that always wakes me up. So, but I do look back, and it's usually the days that I don't drink a lot of water. So you have to drink, and, but then it's that double sword, because that's going to wake me up at night.
Then you're going to go to the bathroom, I know.
So I don't know what's worse. The pain is going to wake me up anyway.
And you said the magnesium.
Yeah, and you know what? I had one this morning, and I just popped a Tums. I don't know why the Tums just get like immediate. It helps.
Huh.
So whatever works.
Good, yeah. A lot of the things I learn are from people that are telling me, do you know this is how you help hot flashes? And I was like, thanks for letting me know. I'll pass that along.
I live at over 6,000 feet above sea level. I have no leg cramps at sea level. When we go on vacation, no leg cramps. And I went to my doctor and I said, I have a theory. I think I'm lacking oxygen at 6,000 feet. And so they did the oxygen on my finger, that test, and I was lower than 90%, part of the 23% of the time. So I think it depends on where you live.
So you know what that means, right? Now you have to move.
So
Or go on permanent vacation. That sounds good.
I had a stem cell transplant 3 years ago, and at one point I was getting extremely painful leg cramps, which would wake me up at night. And someone said, try pickle juice, and I didn't believe them. And drinking pickle juice, it goes away almost instantaneously.
Huh.
And go right back to sleep.
Wow.
Other questions? Or are we going to end on pickle juice? Because that's one that's going to stick.
I think that's just basically the bottom line is pickle juice.
My problem is just the opposite. I'm on Revlimid, and I am truly exhausted. I sleep, I'll sleep 14 hours a day, and if I try to get up, I have heart palpitations, and if I can stay awake for 2 hours, I take Nuvigil, and then I'm pretty good for about 10 or 12 hours, although if I sit down and stop and do, or I try to, say, run the vacuum for 20 minutes, I'm so exhausted.
Right. And so when you say exhausted, I'm hearing sleepy, because it sounds like you can sleep a lot.
Well,
but is it, like I was talking about earlier, fatigue and sleepiness, is it a combination of the two?
It's probably a combination, but, I mean, I ache, my heart beats, I'm short of breath.
I mean, my first thought would be it probably would make sense for you to see a sleep physician. Have you had an overnight?
I've had him twice, and there was nothing.
Okay. So you didn't have sleep apnea?
No.
Okay. I mean, I'm not sure what's causing the sleepiness. It's definitely not okay to need to sleep 16 hours a day. I mean, that's not how we're built. So I'm not sure. I mean, I would need to talk to you more one-on-one to kind of find out more information, and, I can give you my card and you can take it. But people do sometimes find that taking a low-dose stimulant can be helpful in terms of kind of perking you up throughout the day. I don't know that that's like the ideal solution, especially if that's masking something that we haven't figured out yet. But I know that in our clinic, in our broader clinic outside of the sleep center, but just, with the behavioral medicine program, that, our psychiatrist does sometimes give a low-dose stimulant for people to kind of give them a little bit of pick-me-up to get throughout the day. But take my card, and we can correspond one-on-one a little bit more if that would be helpful to you, and I can find out a little bit more about, what your experiences are and see if I can give you any more personalized advice.
Okay, thank you very much.
Sure.
Probably have time for one last question, I think. Yes?
Hi, I'm 2.5 years out from my transplant, but before this, I had problems with statin, and that's why I had all the leg cramps. So if you're taking anything for cholesterol, you might ask the doctor, because I got really bad leg cramps. And even the natural one, that red yeast rice gave me bad Charlie horses. So check with your doctor, because it could be the statins that are giving you the leg cramps if you take them. Yeah. Oh.
Well, maybe try pickle juice.
Yeah, pickle juice.
Maybe try pickle juice. Oh, you have? I believe you. Yeah, I believe you. It's wild. There's probably less side effects to pickle juice than some of the other things that you could take.
We'll take this one last question. Here you go, dear.
My dad had leg cramps often when he got older, and my father had leg cramps often when he got older, and he drank, I think it was tonic water with quinine. And it doesn't. Oh, I see. Because it worked for him.
Yeah, Amy, thank you so much.
Oh, my pleasure.
Great.